In this video, we'll do an exam review on the bacteria that adhere to the intestinal cells and cause diarrheal disease. Bacteria that adhere to the intestinal cells and cause diarrhea are E. coli, Vibrio, cholera, and campylobacter jejuni. In this video, we'll discuss E. coli, Vibrio cholera, and campylobacter jejuni will discuss in the other video. But first, few important exam questions and then we'll do the E. coli. Question number 1. Which E. coli causes most common and most dangerous infections in the abdomen? Number 2. Which E. coli toxins are similar to Shigella and cholera toxins? Number 3. What's the difference in the features of Enterohemorrhagic and Enterotoxigenic E. coli? Number 4. What's the pathology of Enteropathogenic E. coli? And number 5. Why E. coli infection is more common in neonates? So now let's discuss the E. coli. How different bacteria cause food poisoning. The topic number 1, food intoxication by the preformed bacterial toxin, we discussed in the other video. Number 2, non-invasive bacteria that adheres to the intestinal wall and produce toxin. They include E. coli, Vibrio cholera, and campylobacter. And the third variety is intracellular, and the fourth one is the bacteria that enters the blood. Now let's discuss E. coli. E. coli is a gram-negative motile flagellated bacillus that infects any organ. The most common site of infection is urinary tract in half to 2/3 of cases, and the second common site is abdomen in 25% of cases. The abdominal disease by E. coli causes enteritis, colitis, and enterocolitis. It also causes infection of the soft tissues, bones, immunodeficiency, and intravascular catheter infections also occur due to E. coli. E. coli infections are more in achlorhydria patients, so HCl is protective to E. coli infection. Humans are the major reservoir of E. coli except Enterohemorrhagic E. coli. Domestic animals like cattle and young cows are their reservoirs. Now, types of E. coli. Number 1, Shiga or Shigella toxin producing E. coli or Enterohemorrhagic E. coli. Number 2, Enterotoxigenic E. coli. Number 3, Enteropathogenic E. coli. Number 4, Enteroinvasive E. coli. And number 5, Enteroaggregative E. coli. All these E. coli are, number 1, non-invasive. They just adhere, except the enteroinvasive E. coli, as the name indicates, the enteroinvasive, which is invasive. And number 2, they may be inflammatory or non-inflammatory. The non-inflammatory E. coli are Enterotoxigenic E. coli and Enteroaggregative E. coli. Vibrio cholera is also included in this video. We'll discuss it in the other video. The inflammatory E. coli are Enterohemorrhagic and Enteroinvasive E. coli, and campylobacter jejuni is also inflammatory bacteria that causes diarrhea, but we'll discuss it in the other video. Now, Shiga or Shigella toxin producing Enterohemorrhagic E. coli. Enterohemorrhagic E. coli may cause, number 1, hemorrhagic colitis involving the large intestine, and number 2, it causes hemolytic uremic syndrome. A small dose of Enterohemorrhagic E. coli, 10 to 100 organisms, may cause infection. The other organisms that in a small dose cause infections are Giardia lamblia and Entamoeba histolytica. So these three organisms in a smaller dose may cause infection: Enterohemorrhagic E. coli, Giardia lamblia, and Entamoeba histolytica. The infection with Enterohemorrhagic E. coli occurs more in industrialized countries, and the serotype 157H7 is the most common that causes enterohemorrhagic infection. It's the fourth most common cause of bacterial diarrhea in the USA. The other three are Campylobacter, Salmonella, and Shigella. So these are the four most common causes of bacterial diarrhea in the USA: Campylobacter jejuni, Salmonella, Shigella, and Enterohemorrhagic E. coli. The most common serotype is 157H7. Large outbreaks of Enterohemorrhagic E. coli may occur by eating, number 1, undercooked ground beef, and number 2, other foods and vegetables like fresh spinach. Incubation period is 3 to 4 days, in which there occur colonic edema. So enterohemorrhagic type affects large intestine, and the reservoir for this are cattle and young calves. Now, pathogenesis of the enterohemorrhagic E. coli. Tolerance and adherence are necessary factor for pathogenicity. They attach by attachment, effacement, inflammation to the enterocytes and produce verotoxin. And what's verotoxin? A cytotoxin that causes colonic edema and bloody diarrhea. The toxin is Shigella-like toxin and has 2 subunits, an active A subunit and 5 identical B subunits. A subunit cleaves the adenine from the host cell's rRNA, thereby irreversibly inhibiting ribosome, that is, ribosome inhibiting protein. Clinical features of Enterohemorrhagic E. coli: pain abdomen with secretory diarrhea followed by grossly bloody diarrhea in 90% of cases, and there is no fever in enterohemorrhagic type. So crampy bloody diarrhea with leukocytes in the stool without fever. The food sources for enterohemorrhagic type are: number 1, ground beef, which is most common; number 2, potato, lettuce, spinach, sprouts; number 3, contaminated water; number 4, person to person transmission in daycare center is an important route for secondary spread. Person-to-person infection also occur with Shigella and Giardia lamblia and Entamoeba histolytica. Now, complications of enterohemorrhagic type. The toxin is carried by RBC to the kidney and brain, causing thrombotic microangiopathy that causes fever, thrombocytopenia, renal failure, stroke, seizures, blindness, and encephalopathy. So when does hemolytic uremic syndrome occur? It occurs 2 days to 2 weeks after diarrhea and affects mostly very young or elderly. And more than 50% cases of hemolytic uremic syndrome are due to enterohemorrhagic E. coli. Diagnosis of enterohemorrhagic E. coli. E. coli strains of 157 that do not ferment sorbitol is the most common method to detect enterohemorrhagic type. Shigella toxin test is more sensitive, specific, and rapid. It detects both non-157 EHEC and sorbitol fermenting strains of 157H7. The second type, Enterotoxigenic E. coli, traveler's diarrhea. The enterotoxigenic E. coli causes watery diarrhea, produces an adherence protein called colonization factor antigen. The enterotoxigenic type causes endemic diarrhea in developing countries, mainly during the first 3 years of life. The incidence of the diarrhea decreases after this age, after 3 years of age. Why? Due to decreased colonization, due to decrease in adhesiveness and increase in immunity. It's the most common cause of traveler diarrhea, 25 to 70% of cases. Enterotoxigenic E. coli infection occur from contaminated water, poorly cooked or food or unpeeled foods or fruits. The toxin of enterotoxigenic E. coli. 2 types of toxin: heat labile and heat stable toxin. Heat labile toxin consists of A and B subunits and is similar to the cholera toxin, causing cholera-like illness that activates adenylate cyclase, increasing cyclic AMP and causing net fluid secretion in the jejunum and ileum. So it's affecting small intestine, unlike enterohemorrhagic E. coli. The B subunit binds to the cell and translocates A subunit, and the heat stable toxin activates guanylate cyclase in the jejunum and ileum, causing watery diarrhea and cramps. Guanylate cyclase in the brush borders causes increased intracellular concentration of cyclic GMP, activating guanylate cyclase, causing increased fluid secretion, leading to watery diarrhea. Histopathological changes are absent in a small bowel, including blood, inflammatory cells, and fever. Now, Enteropathogenic E. coli. They cause infant diarrhea. Cause outbreaks of infant diarrhea under 1 year of age. Infant summer diarrhea in infant nurseries. Breastfeeding decreases the incidence of enteropathogenic E. coli infection. Rapid person-to-person spread may also occur. Enteropathogenic E. coli attaches to enterocytes through pili and damages microvilli and causes characteristic effacement of microvilli with the formation of cup-like actin-rich pedestal. It causes watery diarrhea with mucus and fever. Diarrhea may persist for weeks and stool may contain mucus but no blood. Now, Enteroinvasive E. coli infection. This is uncommon in USA. Genetic and clinical features resemble Shigella, but a large dose is required to cause the disease. Enteroinvasive E. coli's enterotoxin causes secretory small bowel diarrhea and then subsequently invades the colonic mucosa, multiply there and spread cell to cell, results in colitis, characterized by fever, pain abdomen, tenesmus, and empty stool that contain mucus, blood, and inflammatory cells. So, enteroinvasive type, uncommon in USA, resembles Shigella. Enterotoxin causes secretory small bowel diarrhea first and then invades colon, causing colitis and diarrhea. Now, Enteroaggregative E. coli. They cause infection in developing countries, especially in children 2 to 6 years of age, and cause prolonged watery diarrhea. It also causes traveler's diarrhea. Organism causes diffuse or stacked brick type of adherence to the epithelial cells. Enteroaggregative E. coli, Vibrio with plasmid virulence adhere to the mucous surface of the intestinal cells and produce enterotoxin. Now, answers to the questions. Question number 1. Which E. coli causes most common and most dangerous infections in the abdomen? Most dangerous infection is caused by Enterohemorrhagic E. coli and most common is caused by Enterotoxigenic E. coli. Question number 2. Which E. coli toxins are similar to Shigella and cholera toxin? Enterohemorrhagic and enteroinvasive E. coli toxin resemble Shigella toxin, and Enterotoxigenic E. coli toxin resembles cholera toxin causing cholera-like disease. Question number 3. What's the difference in the features of enterohemorrhagic and enterotoxigenic E. coli? The enterohemorrhagic causes pain abdomen with secretory diarrhea followed by grossly bloody diarrhea in 90% of cases. The enterotoxigenic E. coli cause watery diarrhea. Heat labile toxin consists of A and B subunits similar to cholera toxin causing cholera-like illness. Question 4. What's the pathology of enteropathogenic E. coli? Enteropathogenic E. coli attaches to the enterocytes and cause dissolution of microvilli. Localized adherence causes characteristic effacement of microvilli with the formation of cup-like actin-rich pedestal. Question 5. Why E. coli infection is more common in neonates? E. coli infection in neonate is due to increased adhesiveness of the organism and increased permeability of the intestinal cells.